sometimes wound is still the break in the continuity of the skin, and sometimes certain authors consider wound only to be traumatic. Is it clear? But this is not always the case. Certain authors like saying that the wound are only traumatics, while other authors like saying that wounds are just a way of explaining ulcers, but in the form of a history. When the patient is explaining to oneself, you are explaining the wound, you are describing the wound in your history, and then on your physical examination, you have an ulcer. Just like neck stiffness and rigidity, neck stiffness is a symptom, while rigidity is a sign. Now, the next thing after speaking about the wound, inside the wound, you need to know that what there are characteristics of wounds. Is it clear? Inside the wound, you need to know that what there are phases of wound healing. Is it clear? So every time that you have a wound in front of you, you must know that there are phases of wound healing. There are three major phases of wound healing. The first phase is the inflammatory phase of the wound healing. The second phase is the proliferative phase of the wound healing, and then the third phase is the remodeling phase of the wound healing. So those are the types, the stages of the wound healing. I hope you're understanding. Now, inside the stages of the wound healing, the inflammatory states occur for the first 6 days. Is it clear? The proliferative phase is to the next 6 weeks to 6 months. Is it clear? The proliferative phase, depending on the disease, is to the next 6 weeks to 6 months, and then the remodeling phase is for the next 6 months to 2 years, the remodeling phase. So that is how you have to understand. And the inflammatory phase is for the next 3 days to 6 days. So you start from day 0 to day 3 or day 6, depending on the type of wound that you have in front of you. Is it clear? Now, for the proliferative phase, it's continuous from day 6 to the next 6 weeks to 6 months, and then the remodeling phase, it continues from the 6 months, 6 weeks, depending if you are starting from 6 weeks and then it goes to 6 months, or you can start from 6 months going up to 2 years, depending on the type of wound that you have in front of you. So now, what happened inside the inflammatory phase of wound healing? Now, inside the inflammatory phase of wound healing, you need to know that you are going to have the processes of inflammations. So you are going to have the leukotrienes, that is a release of the interleukins, and prostaglandins, interleukins and prostaglandins, which are going to activate the process of inflammation. We are going to have the neutrophilic chemostasis. You're going to have neutrophilic chemotaxis to that particular region, and the neutrophilic chemostasis is what is going to result to inflammation, which is going to result to the resorption and the necrosis, and the resorption of the necrotic material, such that we are going to have the production of new cells. Now, in the proliferative phase of the wound healing, the second part is that you are going to have now granulation tissues. You're now going to have granulation tissue formation. And this granulation tissue formation is very important because you have characteristics of good granulation tissue. If you have good granulation tissue, it means that the wound is healing. If you have poor granulation tissue, it means that the wound is only healing or chronically healing. So that's why later I'm going to speak about the characteristic of a good granulation tissue. The next thing is going to be on the remodeling. For the remodeling, here now you have conversion from granulation. You need to know that granulation tissues are just tissue that constitute of fibroblasts. It consists of red blood cells. It consists of monocytes. And particularly, it consists of these monocytes. Why? Because the monocytes are going to produce the fibroblast growth factor. It's going to produce the fibroblast growth factor. You're going to produce a tissue necrotic factor, such that the tissue are going to necrose. You're going to produce a fibroblast growth factor Is it clear? It's going to produce the blood vessels growth factor. Is it clear? It's going to produce the blood vessels growth factor such that the blood vessels can proliferate for the production of more connective tissues. Is it clear? That's what the granulation tissue is going to contain. Fibroblasts, even the red blood cells, even the blood vessels and the monocytes. Now in the remodeling phase now we have what is called scarring. Is it clear? And we have the remodeling of scarring. And the pathology that can occur inside the scarring and the remodeling of scarring is that you can have a hypertrophic scar. Is it clear? In this case, you can have hypertrophic scar or you have also keloids. These are the two cases which are involved. Either it is hypertrophic scar that you're going to have or you're going to have keloids. Is it clear? So that is a brief explanation on the wound healing. Now, on the stages of wound healing. After explaining the stages of wound healing, it's also very important to understand that after the stages of wound healing, we are also going to speak about the types of incisions. Is it clear?